I want to bring in now one South African movement leader, Mmusi Maimane. He's expressed relief at Cabinet's decision to suspend schooling for the next 4 weeks. Mr. Maimane, very good morning to you.
Good morning, and good morning to fellow South Africans.
You reckon the president made a good call in terms of closing it for 4 weeks?
We're heading into a worst pandemic that South Africans ever faced into. We're seeing the number of deaths rising. What the preliminary science that argued that young people aren't carriers is now being refuted, in the sense that we're seeing young people die from the virus. We're seeing teachers infected. And the World Health Organization advises, quite deliberately so, that community spread is something that must be in control if you're going to open schools. So it is in many ways the absolutely correct decisions to shut the schools in this period as we head towards the peak period, and work towards an adequate preparation plan.
Is 4 weeks enough? I ask that because even the best experts in this field they don't know the exact trajectory of this disease. There's so many unknowns with regards to COVID-19. Should it be at the end of 4 weeks, let's see where we are and make a decision, or should we come back regardless with regards to the 4 weeks and put in place these health protocols that we've been talking about in schools to get on with the academic year?
I think there's been a lot of arbitrary decision-making in terms of time. To say to the matriculants it's only a week off, on what basis is that? This particular government has gone into hiding in terms of the scientific research that they're dependent on as to when and how to open schools. So I would argue the strong case that rather we've now have 4 weeks. In that 4 weeks, the only thing that we should be obsessed about is building a blended learning centers, making sure that we avail every other facility in communities to make sure that learners can be spread out. Because frankly, to be honest with you, the decision to open schools can only be on the basis of the spread of the virus. And therefore, in 4 weeks' time, I think a thorough assessment must be done. But we can't sit and wait. This is not about that. We would be wasting a crisis. It's an opportunity to reform education and make sure it's equitable for all. And I welcome, furthermore, the extension of the academic year into 2021. Because whilst it may be difficult for many parents, and I want every learner to get back to school as soon as possible, but actually what it does do is that it allows us the space to adjust curriculum and make sure that we put the proper measures in place so that all learners are given a fair chance. The last thing you want is a matriculant who's going to be writing exams in conditions where, for the poor schools, they've had to open and shut, have teachers infected and leave, whereas for some of the other schools, they would have had a fairly stable environment. So let's provide a fair opportunity for all citizens in our country.
You hear the argument being made, even in the United States as well. And here's the pushback, Mr. Maimane. Did you hear about this South Korea study, for instance? They're saying that children under the age of 10 transmit less, not zero, less. Children, we're told, if they get infected, have less severe symptoms. This disease is going to be around for a long time. Send the kids back to school. We'll see what happens. Your response?
Seeing what happens isn't an option, I'm afraid, because communities, schools are centers of communities. I make this basic argument that, in fact, we don't write policy in a world as we imagine. We write policy in a world as we have it. And what we have in South Africa is profound inequality in schools. We have communities, we have hospitals. The Eastern Cape has run out of beds. So even if you say wait and see and hope that teachers will be able to find beds, or 16 or 17-year-olds or 18-year-olds who are in matric will find beds, that is a risk I'm afraid we're not willing to take. If you said to me KZN is heading into a peak period, and they will soon run out of beds because the government has failed to prepare, this is the reality that we're facing with. So we cannot be, in some ways, importing research from nations who have been able to quickly adjust, avail more beds, etc. Whereas in South Africa, I want to give a very practical scenario. If a teacher tests today for COVID, the first time they'll be able to get their results is in 7 to 8 days from now. So in all reality, that teacher may be infecting a whole community of people before even knowing their results. So I think the reality of our context is that South Africa is in the majority third world, It's in majority a country upon which we need to treat our citizens in a manner that says, how do we deal in that environment that is very rural, in certain contexts with no water, and ultimately with some no PPEs. So that is the context we operate within. So I would urge that we need to be able to deal with our South African citizens in that manner.
You make an important point with regards to testing and getting that results apace. I mean, if you taking about 7 days to get a results, that defeats the whole purpose in terms of the effective contact tracing. I was listening to a medical expert the other day saying that one person potentially can infect 59,000 people in weeks, whereby one person infects 3 people, those 3 people infect another 3, and so on, until you get this exponential growth. So testing and getting the results within 2 days or less is important, something that we need to aim for. Your application to the Constitutional Court to appeal the judgment that favored government in terms of reopening schools, I understand that you will still be pursuing that. To what end?
Well, the question on the table is, I think it's an important principle we must establish. You know, the Constitutional Court rates the right to life as supreme in our country. And that right cannot be, in many ways, balanced off with a number of other rights, the right to education, etc. Whilst all rights are important, they also have to face up to a degree of ranking, because we want South Africans to be alive so that they can enjoy the rest of the rights. And therefore, if you then equate those rights, as is the judgment in the High Court, it means that in future a government could make decisions that equate other rights to the right to life. Now, the sacred nature of our Constitution is that it must preserve the right to life, and that right is absolute. So we've got to go out to the Constitutional Court to argue that case so that we can safeguard all learners. And I think, to me, and I think it's a point that cannot be lost, is that we've often, when we talk about all of these rights, the fundamental question South Africa must be asking itself right now, today, is how do we make sure all citizens, all learners, get an equitable education system in a safe environment that guarantees all their safety? Because there's an underlying undertone in the argument that says, well, the wealthy schools are ready and they must carry on, etc., etc. That's not what the Constitution envisages. It envisages that all citizens enjoy that right. And I think it is incumbent upon all citizens to say we stand in solidarity. Because today, if you say it's okay for poor kids to go to schools that are less than prepared, it will be true in other contexts, hospitals and healthcare, etc. And I think that's not the South Africa we want to see.
You know, the president yesterday didn't say anything with regards to private schools. He mentioned in particular public schools. There's this debate going around now with regards to what happens to private schools. My understanding is that, and I obviously speak under corrections, that they will close very soon and open only in early September. But if they do remain open, COSA says, the student body says, they want to shut down these schools. What's your take with regards to some who are raising the issue of the inequalities between public and private schools?
I think to put the dividing line between public and private schools is a false division. Because frankly, this is about income and wealth. It's got nothing to do with public or private. There are wealthy public schools and poor public schools. There are wealthy private schools and poor private. And I know for a fact that in rural communities you'll find missionary schools that deal with that, and there are poor schools. So the question that we should rather phrase it at is, how do we all as a society zone in to schools that are particularly poor and say, in solidarity as a society, we must stand together and say, well, let all schools shut. Because at this point in time, yes, there are schools that are ready. Yes, there are schools that are wealthy enough to provide PPEs and provide rotational mechanisms. Yes, and learning online. We accept that. But that is not in solidarity with the rest of the country. And what I'm trying to ask is, doesn't matter whether you are public or private. The question you should put on the table is, how do we shut it for everyone? How do we ensure that we focus and zone in on poor communities and poor schools, that we can uplift them so that all citizens can get a good education? To simply say it's a public-private debate, I think is missing the point.
Yeah, and COVID-19, I guess, compounds the situation. There are still so many unknowns with regards to this virus, which complicates the process of reopening up. Mmusi Maimane, leader of the One South Africa movement, we thank you very much indeed, sir. God bless. Be well.
Thank you very much.